Hi, I'm Dr. Janine Johnson. Welcome. You're watching this video because you or someone you care about is suffering with migraine headaches or some sort of chronic headache, particularly migraine headaches. When I say suffering, you are suffering. It is like having an ice pick or a knife in your head. It's excruciating. You become sensitive to light. You get nauseous. Sometimes you vomit. Sometimes you just have to lay down in a dark room and just hope and pray it passes soon. I want to just share with you how we help patients with chronic migraine problems, migraine headaches. We take a three-pronged approach. We look at a migraine patient metabolically, which means I do lab testing that has not even been considered. I look at the person neurologically, and I do what's called a functional neurological evaluation, where I look at all the different parts of the brain, and then I look at a person structurally to see if there's some misalignment that could be causing a trigger and having them have these chronic migraine headaches. Let me explain to you a little bit further what we do. We don't treat every person the same. Not every migraine headache patient is going to be treated the same. There's no protocol. There's nothing cookie cutter. It's completely unique to each person. First thing we do is we're going to do, after we get your history, we do an evaluation. Then I move on to lab testing. And you may think, well, I've had lab testing done. I've had all these testing done, and they can't find anything. Well, you haven't had this kind of testing done. This is a really expanded panel. It's also known as a Chem 55, where we have the lab run a complete CBC with auto differential, where they're breaking down the red and white blood cells. We do a complete metabolic panel, a complete lipid panel, a complete thyroid panel, where we're not only looking at TSH or T3, T4, but we're looking at all the thyroid markers like free T3, free T4, total T3, total T4, T3 uptake, reverse T3, and the thyroid antibodies. Really, when you have an expanded panel like this, it helps to really pinpoint where these problems are coming from. It also helps us to look at the liver, the gallbladder, look at blood sugar, anemias, things that just really have not been considered. Then we're going to look at you to see if you are sensitive to gluten, soy, egg, yeast. Maybe even you might be cross-reacting to foods, which when I say what does that mean? Well, we test you for 24 different foods that you may not even consider to be bad foods, but it could be rice, potato, chocolate, that you could be reacting to, that are triggering your migraine headaches. We're going to look at for adrenal stress. The adrenal glands are the stress-handling glands, and so when you have a chronic health problem, you have chronic adrenal problems. And many times you may be up in the middle of the night, can't sleep, dead tired during the day. Your sleep patterns may be all over the place, and the adrenal stress test will tell us where you are with that. We'll look at your cortisol levels, your DHEA. A lot of times we'll check the male and female hormones at the same time, because all these hormones, when one starts to have a problem, they all start to have a problem, and there's an intricate dance between hormones. We also will have you possibly have you checked for leaky gut. Now, leaky gut, I want you to think of leaky gut like there's a screen in your window, and the screen allows air to come in and keeps the bugs out. So in your intestines, you have a filtering system, and leaky gut is when you have a hole in that system. And now things are getting into your bloodstream that shouldn't be there, like food particles, viruses, bacteria. I want to see if that's a problem. We may even have you do a stool test, where we're checking for parasites, yeast, bacteria, fungus. And the reason that's so important is because 80% of your immune system is in your gut. So what you eat and what's happening in your overall digestive system is huge. You have to reduce inflammation in the gut to reduce inflammation in the brain. There's no doubt about that. Then I'm going to also look at you neurologically. Like I said, we're going to look at the right and left side of the brain, all the lobes of the brain. We're going to check to see how the brainstem is working. Because when you have migraines, many times you have an overfiring in a part of the brainstem called the mesencephalon. So we want to see if that is an issue for you. And then again, we want to look at you structurally to see if the alignment could be a factor in your chronic migraines. Now, if you want to have a consultation in our office, what you need to do is you need to call our office. Our number is 882-5533. When you call, you'll be asked a few questions just to make sure that you're in the right place. I guess if you want to call it, we call it qualifying. We'll be qualifying you as a patient to make sure that you're in the right place and there's no waste of time for either you or for our office. If you would just like more information, you can opt in, leave your email address, and we'll be happy to send you more information on chronic migraines. I really look forward to helping you get your life back, because I know with a chronic migraine problem, this really wreaks havoc on your quality of life and really keeps you from the things that you like to do. I really look forward to helping you try to get your health back on track, get your life back. I'm Dr. Janine Johnson. Have a great day.